How do we know just by looking at the eyelids and lashes what would be the best treatment or the best dry eye treatment for that patient? If you look at these eyelids, how do we know if warm compresses will be helpful, IPL, thermal expression, eyelid hygiene, or maybe just eye drops? Let's focus in. So when we're examining a dry eye patient, likely this person has meibomian gland dysfunction. Their oil glands aren't working properly. We need to decide if we are looking at an inflamed eyelid or an obstructed eyelid. If the eyelid looks like this is an inflamed eyelid, a hot eyelid. Definitely can tell there's a lot going on there. There's some inflammation definitely at the base or the eyelid margin. You can see these telangiectasia, these baby blood vessels that are in there, just kind of looping around the meibomian glands. And those telangiectasia, they're highway off-ramps for inflammation markers. Inflammation markers just go down these baby blood vessels and get leaked into the eyelid and wreak havoc, cause inflammation, and cause the oil glands to not work properly. A lot of times we see this presentation in the aging population or people with ocular rosacea. As far as in-office treatment for this, we're usually going to reach for IPL, intense pulse light. This will be the best for decreasing inflammation and destroying those little baby blood vessels, telangiectasia, so you can just get rid of the highway off-ramp for the inflammation markers. This is also one that might want to avoid warm compresses. There are a lot of people out there that go to do warm compresses to help with their dry eye symptoms, and they find out, hey, this is making my dry eyes worse. My eyelids get really inflamed, really irritated, and it's probably because the eyelid is already inflamed, and this is just making those baby blood vessels even bigger, wider, just getting in the inflammation so it can get into the eyelids. A lot of times this person can look at their diet to kind of reduce inflammation. If they look into anti-inflammatory diets, looking at high antioxidants, fruits and vegetables, avoiding triggers. A lot of times this can be dairy, reducing alcohol intake, and trying to increase omega-3 fatty acids. This person will likely benefit from lipid-based artificial tears, so that's kind of an oily layer artificial tear, and could possibly benefit from red light therapy. A few prescriptions that a doctor might reach for definitely can benefit from a steroid eye drop or ointment. This is an anti-inflammatory eye drop just to kind of decrease the inflammation. This person could also benefit from Meibo. This is just a prescription to help with the oily layer of the tears. And a doctor might reach for doxycycline. This is an oral antibiotic that has properties to decrease inflammation and can do really well targeting the eyelids. Next, also in the same category as an inflamed eyelid, we might see an eyelid that looks like this. Now, this is typically what we say when we're talking about an inflamed eyelid. In fact, this is called blepharitis, or an inflamed eyelid. But when we're talking about the official term blepharitis, we're usually referring to flakes and debris and scaling of the eyelids and eyelashes, as you can see in this picture. This person will likely benefit from eyelid hygiene. This can be a routine habit of cleaning the eyelids. Either you're using baby shampoo, that's kind of the generic way that a lot of doctors will say to use to clean the eyelashes, can be very cheap. There are better ways, better eyelid wipes and washes. I'll just kind of put them right here and in the description if you want to check those out. Another thing that you might hear a lot is the use of hypochlorous acid spray. This is a type of spray, over the counter, not prescription, and actually can help control the overgrowth of that bacteria. Some prescriptions a doctor might also reach for in this one is also an ointment. Sometimes they'll reach for a combo anti-inflammatory and antibiotic to try and help with that overgrowth of bacteria, and this can be in an eye drop form or an ointment form. And sometimes you might be offered an in-office procedure of a lid debridement. So this can be from BlephX or NewLids Pro, where they actually take a vibrating or oscillating tool to kind of forcefully remove all that debris from the eyelids and lashes. You can also have some home tools like NewLids to help with this at home. If your blepharitis is really bad and your dry eyes are really bad, this can be a great tool to have. And then the other thing to look for are eyelid mites. This is something a little bit different called Demodex blepharitis, and we'll cover this at the end of the video. Now we can get in the category of an obstructed eyelid. Now we might look at a patient and notice, hey, you know what? There's not really a lot of inflammation here. I don't see any debris or typical blepharitis. But when we look closely at the meibomian glands or the openings of those oil glands, we can see that maybe they're obstructed. They might have capped glands like this, Or if we kind of push on the oil glands or try and express the oil glands, they'll have a thicker oil like this, maybe even to the point of thick toothpaste when you try and express and get that oil out. So this person likely will benefit from thermal expression. This is also another in-office procedure like LipiFlow or any other device that can apply heat to those oil glands, liquefy the oil that's in there, and then express that oil to get the old, thick, rancid oil out of there to clean it out. It can also be recommended a lot of the times to do a routine warm compress with eyelid massages, stuff that you can do at home. This is where you can try and keep those oils from hardening and thickening inside the oil glands, where you can liquefy them and get them out at home, and do this on a routine basis to keep your oil glands working. This person also can likely benefit from lipid-based artificial tears, also a prescription of Mibo to help create a new oil layer barrier with the tears. Also could benefit from red light therapy and omega-3 supplements or increasing omega-3s. Now another niche category of an obstructed eyelid is when you actually have keratin or eyelid scaling that are blocking those oil gland pores or the openings of the oil glands. And this is where you might hear of meibomian gland probing. This is where a doctor can take a gauge probe and open those oil glands one by one. Not a lot of doctors offer this, and it actually can be very hard to find someone that can do this, but luckily there is a new dry eye medication that's coming out that targets keratin production. It's an ointment that you can put on your eyelids and hopefully will reduce and get rid of that keratin, hopefully opening up and unobstructing your oil glands. Now, let's be honest here. In the world of dry eyes, a lot of times patients will come in and likely have a combination or maybe all of the above of these presentations of eyelids here. And so that results in likely having a combination of treatments that are prescribed to that patient. Now, let's say you see a specific type of blepharitis or eyelid debris that looks like this, where a lot of the debris is on the base of the eyelashes, kind of has this cylindrical dandruff. This is a typical sign of something called Demodex blepharitis, where it's not a bacterial overgrowth, but it's a mite overgrowth. So those are eyelid mites that are living in the eyelash follicles, causing havoc. And this can actually be more common than you think. I think upwards of 60% of more of people that actually have blepharitis actually have Demodex blepharitis. So if your doctor does mention this, don't be alarmed or grossed out. In fact, a lot of people have these mites just living on their face. It's part of our natural flora. But if it does get into the eyelash follicles and get overgrown, it can cause these problems. But I go into more detail about exactly what they are, how you can get rid of it right here in this video, so check it out. If you have any questions, leave them in the comments. Stay focused.